With some pain, you can just grin and bear it. Not shoulder pain. It's nearly impossible to work. Forget playing with your kids or grandkids. Even getting milk out of the fridge can be terribly difficult. With shoulder pain, it gets in the way of everyday living, and it may be time to look into shoulder surgery. From CHI Health orthopedic surgeons Dr. Matthew Delisio, Dr. Samuel Dubrow, and Dr. Eric Samuelson. It's nice to have all three of you here. I feel like you're so busy, so to have three of you on our couch, it's pretty cool.
Thanks for having us.
Of course. So let's talk first about causes. When patients come to you, what do you see that's causing the shoulder pain?
Well, shoulder pain can be caused by from numerous reasons. A traumatic event can cause a fracture or a tear in the muscles of the shoulder. The number one reason why we see shoulder pain in the office, though, is usually due to the rotator cuff. And people have injuries to their rotator cuff. The rotator cuff can be injured, more than likely, it happens over a degenerative process. It's just general wear and tear. And I liken it to a pair of blue jeans. When you have a little hole in your knee and you keep using it and keep wearing them, it gets bigger and bigger and bigger and the pain presents itself. That's what happens in the shoulder.
What can you do about it? If it is rotator cuff or if there's some other problem, I'm sure the treatment options vary based on the origin, but what do you recommend?
Typically start with a trial of conservative treatment, including anti-inflammatory medications, physical therapy to work on strengthening some of the muscles around the shoulder, working on the mechanics of how the shoulder moves in space. And then for folks that have quite a bit of pain, sometimes we use steroid injections to try and alleviate some of their symptoms.
When we talk about surgery, and I know you want to start conservative and then we ramp up, but some people, they've tried everything else, and maybe it is time for surgery. The success rate for it, what do you see most?
Usually, for most surgeries that we do, it's 80 to 90% good to excellent results is how we normally classify it. So in those patients that do fail non-operative treatment, when it does come to surgery, most of the time we could get people up and running pretty well.
Dr. Dubrow, let's talk about your center and what's unique about it. I think about this whole team approach, and how does the patient benefit by having all of these experts under one roof?
Well, about our surgical center, the nice part about it is we have physical therapists, a nurse coordinator, and orthopedic surgeons all specializing in shoulder surgery and shoulder care. And we're all there collaborating as a team together to provide the treatment in one place. So a patient doesn't have to travel from center to center to receive physical therapy, surgical consultation, and MRI, or any imaging studies that may be required.
So they're saving time and hassle ahead of the surgery. Can it also affect their recovery time?
100%. If you have the nice thing about having a team approach to having people there, if you get introduced to the physical therapist the day of your office visit with a physician, they can get you on a treatment plan right away rather than the following week or 2 weeks later.
And I also imagine if you're not duplicating services or tests, you're also saving some money.
Which is a big benefit of this, yes.
This is so smart. What did you bring in here, gentlemen? I'm curious.
Sure. So these are some instruments of how we fix the rotator cuff.
Okay.
And the way we fix our rotator cuff is with arthroscopy. Arthroscopy is a Greek term. Arthro means joint and scopy means to look. So you put a camera into the shoulder joint to look inside.
And I think about that word as meaning small, right? Smaller incisions.
Small
I don't know if that's an
incisions.
appropriate way to look at it.
It's very true. It's minimally invasive, meaning small incisions that are about the size of a buttonhole. And the camera that we put in is about the size of a pencil tip, so it doesn't require a large incision. And this is what a shoulder looks like right here. And a rotator cuff tear is right here, and this is how we fix it.
At the top of the joint there.
That's correct. And the way we fix it are with suture anchors. This is an anchor. It's a screw, and through it come threads, and those threads get passed through the rotator cuff and attach it back down to the bone. It's very similar to a wall anchor that you may put into a wall.
But it seems so simple. The idea, it's not that fancy.
It's not, and it is simple in when you look at it this way, but the most complexity of a shoulder surgery. That's right. And you screw it in, and the complexity of rotator cuff repair comes to the body's ability to heal. So we have all the tools to put the rotator cuff back so that it can heal. And then
he's unwinding. There's a special handle. This isn't like the screwdriver that I have in my toolbox at home. This is a little more special.
The threads come out and they get passed into the rotator cuff, and it gets tied back down. So here's a torn rotator cuff, and here it's well affixed back down to the
affixed.
screw.
If I think about some of the people in my life who've torn rotator cuffs, one slipped on ice and fell, went to catch themselves, and that's when it happened. Somebody else was reaching for something in the back seat of the car, and that's when it happened. But it sounds like that's just the straw that broke the camel's back. It wasn't that did it. It was the wear and tear over the time.
Exactly, and I think a pair of blue jeans, like I said before, is a good example how the tear gets bigger and bigger with more use.
Dr.
until it
Samuelson,
improves.
is this something, if I'm a patient and I know I need help, should my family physician refer me to your center, or is that a call that I can make on my own?
Either way, honestly, typically patients see their primary care or family physician first, talk about their shoulder pain and what might be able to be done. Like I said, anti-inflammatory medications is a common first step, which we're happy to see the patients on their first visit, but even after they've failed some conservative treatment, contacting an orthopedic specialist that specializes in that issue can be helpful.
Dr. Delicio, would you take us through this seminar? I know 1 week from today you'll be meeting with current and potential patients to answer a lot of questions. We can only do so much in our visit today.
Yeah.
But what are you prepared to address on Tuesday the 19th?
Yeah, we're opening up our center next Tuesday for patients to learn a little bit about it, but we're going to go over all the causes of shoulder pain, similar to what we did, just more in depth today, and then what you can expect, how we can get you better conservatively, and if it does come to surgery, what options we have.
But it's important to know you do have options, that living in pain, as I said, not being able to play with your kids, that's hard. To know there's something you can do about it and then get back to real life, that's the key. Here's some information about the CHI Health Shoulder Center on North 72nd Street. You're welcome to call 717-0820. You can also go to the seminar. It is free, but we encourage you to RSVP prior to Tuesday. And then there's the website if you'd like to log on and learn more prior to calling or going to the seminar to meet the doctors. We appreciate you all being here today. Thank you very much.
Thank you.
Well, your shoulders may feel fine, but someone else you know is in pain. This conversation will be posted online shortly after our show ends today. You're welcome to share the clip from OmahaMorningBlend.com. And later this hour, the restaurant that's auctioning its walls. What makes them special? First, the Orioles are back, so are the Blackbirds. How you can encourage one and discourage the other. That's next.